Hi, this is Curtis Alexander. I'm a pharmacist, and in today's video what I want to talk about is using amitriptyline for migraines. So, right hopping into it, I wrote up here 1, 2, 3, and what that means is that if you're being treated or looked at for migraines, most doctors have to follow a stepwise procedure, and this is primarily going to be dictated by the insurance companies. They're going to require that you start with an abortive therapy, so something like a triptan, a Qulipta, or excuse me, not a Qulipta, but a Nurtec, something along those lines, that when you get a migraine, you can knock it out quick. What a lot of people want to eventually get to is they want to get to the injectable CGRPs, the Aimovigs, the Emgalides, the Ajovy, something that they can inject once a month to prevent migraines. So this journey from starting out with the triptans and working your way up is a stepwise process. And in the middle is our second step, which is oral preventative medications. Something that you take by mouth every day to hopefully prevent migraines that are lower cost. And that's what amitriptyline is, an oral preventative migraine medication. So let's start talking about, does it work? What are the side effects? Those sorts of things. So first and foremost, the dosage. One of the nice things about amitriptyline is you can start out at a lower dose. So in a lot of cases, you can start out at 10 to 25 milligrams a day. You do want it to be taken at bedtime. It can cause drowsiness. We'll talk more about that when we get to the side effects. But start out low. This is what your doctor will do. And then we're going to increase that depending on your response. And we'll increase it by 10 to 25 milligrams every 7 days. Okay, we want you on it for a week. It takes a while to acclimate. We have to make sure you're not getting side effects, those sorts of things. So again, it's a stepwise process. The max dose on amitriptyline is a lot higher than what we use in migraines. Most migraine patients I see are probably going to be, like 50 milligrams at bedtime, maybe a little higher from there. It just depends. But we don't get up to the 150 milligrams that we see in some of the other things that amitriptyline is used for. One of the common questions I get with amitriptyline is, does it cause weight gain? It's an anticholinergic, and we'll talk about that in a second. So have I seen weight gain with it? I have. The studies have shown some weight gain, but keep in mind the weight gain was anywhere from 1 to 3 pounds per month. And it kind of depended on the dose. If we're starting you out at the lower end here, I don't consider it a huge concern. Everybody's going to respond differently, so there's no way to guarantee that. But, if you start low, you go slow, I think you can minimize the weight gain if it does happen. Now let's talk about some of the side effects that we see. And amitriptyline is an older drug. I think it came out in like 1961. Historically, it's in a class of medications called tricyclic antidepressants. That's what it was originally designed for. It does come with a fair amount of side effects. That's the downside to using this class of drugs. Now, I mentioned anticholinergic, and basically a good way to think about that is the processes that occur in your body from salivation. People can get dry mouth, they can get constipated, although some of the other classes of medications we use to treat migraines in this second step, this oral preventative, can be worse on the constipation front. You can see constipation with amitriptyline. Some of the other tricyclics that are in this class, like a nortriptyline, may be a little better in that regard. But so we see some of these dry mouth, urinary retention, constipation. Those are not uncommon side effects with amitriptyline. The other thing we see is drowsiness. Again, this is dose dependent. So drowsiness, fatigue, even confusion. Again, if we start at the lower dose, we can minimize some of the side effects. It's just important for you to know what you might be looking at. And really what we want to know is, what are the results? By and large, people that tend to start on amitriptyline for migraine can see some improvement. It's not the top choice. It's usually something that people have to use along the way to get to the next step. Does that mean it doesn't work? No, it can work for some people. It would, in an ideal world, would it be my first choice for migraines? No, you'd want to hop onto the CGRP, some of the injectables that we talked about. But again, It's nice. You can start out low, we can move them up, and sometimes we can see results. I don't have a percentage for how many people get a decrease in migraines from amitriptyline, but it's something that we do rely on. Some people do see results, some don't. The other thing you want to keep in mind is how long it will take. Most insurance companies are going to require that at a minimum you try a 2-month trial on amitriptyline, many times up to 3 months. So in your head, I would be thinking, I'm going to give this 3 months. I'm going to have to give it 3 months, see if it helps, and then go from there. So hopefully this video on amitriptyline was helpful for you. I hope it was valuable. And until the next video, this is Curtis Alexander. Thanks.